Hi, this is Dr. Nanavati. How are you? Did you know that one person dies every 34 seconds from heart disease? One person every 34 seconds dies of heart disease. Think about that. In fact, 697,000 people died of heart disease, just heart disease, in the US in 2020. That's one out of every five people. That is a staggering statistic. And out of those 697,000 people, more than 400,000 people died from coronary artery disease. Coronary artery that got blocked. And when they got suddenly blocked, people died. The most common cause of heart attacks, the most common manifestation of heart attacks, is a symptom. But in 30% of patients, they have no symptom and they die suddenly, which is probably explaining this staggering statistic. Now, does heart disease have any racial disparity? No, it doesn't. In fact, heart disease is the leading cause of death of males, females, and any racial and ethnic group. Among any racial and ethnic group, heart disease is still the number one cause of death. That is the most little known fact that you don't hear about. You hear about breast cancer, you hear about colon cancer, but you don't hear about heart disease. And just because you're famous doesn't mean you're immune to heart attacks. Tim Russert just had a perfectly normal stress test the week before he died suddenly of a heart attack. He is famous for his long work at Meet the Press. John Candy, actor. James Gandolfini of Sopranos fame. Alan Thicke, as you may recall, who rang in so many New Years for us. We also had musicians such as Jerry Garcia, Luther Vandross, Tom Petty. All of them died of a heart attack. Women are not immune either. Celeste Holmes, Constance Dowling, Carrie Fisher. You may remember Carrie Fisher, who played Princess Leia in Star Wars, and Ginger Rogers. So, no, women are not immune to heart attack either. This is just a short list among a very long, much longer list of famous people who died of heart attacks. Okay, so what is the problem with heart attacks? Why is there such a high number of people dying of heart attacks? The reason is because it's very difficult to detect. Actually, 30% of people who die of a heart attack, their first symptom is sudden cardiac death. So sudden cardiac death represents a large portion of those people. But what about the 70% who do have symptoms? What are their symptoms and why are they not coming to emergency rooms and why are they not coming to attention sooner? Because if they did, we could save them. The reason is because the symptoms are very nonspecific. If you look at the heart is in the center of the chest, but it has no nerve endings of its own. So it cannot tell you if it's having a problem directly. It has to borrow the nerves of the organs around it. And what are the organs around it? The lungs, the muscle tissue, okay, the chest muscles, the rib muscles, the stomach, the diaphragm, and there are certain nerves going up into the neck and into the arms, brachial plexus. Those are the surrounding organs that surround the heart. So what the heart does is it has to borrow from those nerves. And so instead of feeling heart pain or something like that, you end up feeling a chest pressure, or you may feel a indigestion, you may feel short of breath, you may feel pain radiating down the left arm, you may feel pain radiating into the jaw. So these are all symptoms of heart attack. They don't sound like it's coming from the heart, but they indeed are symptoms of a heart attack, which is why we need to pay attention when we have these symptoms, and then we need to go to the emergency room when we feel these kind of symptoms. Okay, so in summary, heart disease is still the number one killer in males and females, and it has no racial disparity. All races are equally affected. Some more than others, but basically all races will be affected. The symptoms of heart attack are very nonspecific because the heart doesn't have its own nerve endings. So be very aware when you have symptoms of like indigestion, or if you have pain radiating to your arm, or if you have a pressure type sensation in the middle of the chest. These are all symptoms of heart attack. Okay? So make sure you pay attention to that and call 911 if you have those symptoms. The life that you save may be your own. Thank you.